we know that there's a bigger opportunity here. People are asking so much for this. This is something that we know we can have a bigger impact on as well. And so we raised a round of funding, about 3.5 million, led by 776.
Hi, everyone. Welcome back. Today, I'm interviewing Aagya Mathur. She is the CEO and founder of Aavia, which is a cycle tracking app. She is based out of New York City. We're really excited to chat with her today on her journey from business school to now being the CEO and founder of this women's health company. Welcome, Aagya. Thanks for being here.
Thanks so much for having me. Really excited to be here and excited to chat with you today.
Okay, Aagya. So I know you started this right out of business school. Where did you go to business
Yeah.
school, and how did you start thinking about Aavia?
Yeah, so I went to MIT Sloan for business school. I actually was introduced to my two now co-founders by one of my now best friends. I really had been talking so much about just how the healthcare system, the things that I think that are shortcomings. And one of my now best friends actually said, "Hey, I met these two people at a hackathon. They talk about healthcare the same way you talk about healthcare. You all should chat." And I thought, great, why not? And little did I know that I would also have similar personal health experiences with them. So that's where we decided we wanted to take this to the next level. We wanted to really ensure that people don't have the same experiences as we do. In terms of our personal experiences, for each of us, it was pretty different. For me, it was that no one had been telling me the whole truth about my health. I started my period when I was 10 years old, and my pediatrician at the time said, "Hey, it's normal that you don't get a normal cycle. You're an athlete." So I said, okay, didn't really think much of it. And then over half of my life later, at age 22, my new OB-GYN at that time said, "Hey, you're not an Olympic gymnast. This is actually not normal. You should be getting a period every month. And so take this medication." And at that time it was the birth control pill. I said, great, how hard can that be? And that was also when I was transitioning from school to working. I was in management consulting, traveling Monday through Thursday, working 7 a.m. to 2 a.m. on some of my projects. I was in meetings at the wazoo, working on a hotel bed, kind of like this. And I would then get to Thursday and my Tuesday pill is in there all the time. So now instead of getting my period every 2 to 3 months, I'm getting my period every 2 to 3 weeks. And I am a science nerd. So I studied neuroscience in undergrad. I actually took the MCAT that I was going to do my MD PhD. And I still really enjoy learning about all things science. But I started looking into it myself of like, what is a normal period, anyways? Why do we have to have a normal period? And why did they put me on this medication? Why does all this matter? And came across the whole world of ovarian hormone health. People with ovaries have this 21 to 35-day cycle, and impacts our quality of sleep, quality of muscle toning, energy levels, sex drive, skin, mental health, mood. The list goes on. And nobody talks about this. Even when I was studying it in school, it was like all about periods and making babies, basically. But this impacts billions of people across the world, right? And I was frustrated. I was like, I was captain of my basketball team, captain of my soccer team. Would have had my teams trained differently, would have taken the MCATs differently, would have taken the GMATs differently if I would have known when in my cycle to really optimize for these things. So my co-founders each have their own stories as well, but Aavia is really the first daily ovarian hormone health app, and we're complementary to clinical services and clinical solutions, and really helps you understand what you may experience on a daily basis, and then accordingly offers personalized and science-backed recommendations for nutrition, workouts, and more there as well. And a big part of what we're doing is also connecting the dots between your lived experiences and how you're presenting them to your doctor, so that you can get the best care possible.
So talk to me a little bit about that initial meeting with your co-founders. Did you guys always know you wanted to do a birth control case, or did that kind of evolve through talking with them? Tell me about the early days of Aavia.
Yeah, so we knew we wanted to be a hormone health company. If I would have told you we wanted to be a hormone health company back then, people would have probably rolled their eyes or, just gone over their heads. It's really with the advent of TikTok, with Gen Z being more and more educated about these things and more loud and proud about all things women's health, instead of a little bit more hush hush as they have been in like my parents' generation and my generation, that this has become much more prominent. Luteal is now something trending on TikTok. Nobody ever talked about luteal phase before. And I can say that as a blanket statement, right? Like, no, like, other than maybe scientists and doctors, nobody else was really talking about it. So this is now something that people are talking about. But anyways, back then we knew we needed to do something in order to really get into that space. And it was a pain point that we had. It was a pain point that we had heard from people, that they, like the birth control pill was just something not as convenient and easy to remember. The average person actually misses about 4 pills per month. And from inconsistent use of the pill, there's actually 1 million unintended pregnancies in the US every year. So we started with the smart birth control pill case. It knew if you took your birth control pill by your daily set time or not, reminded you on your phone app until you actually took it, and then also automatically recorded in there that you took it. We've since actually more or less stopped working on that, in an effort to really focus on the software side of things. We hope to be able to bring it back one day, though.
So do you not offer the birth control case anymore? What do you mean you don't work on it anymore?
Yeah, we don't offer it. It's not available on our website. It's not available for purchase. We do still service people who have it, though.
So why the change? Why did you guys stop offering that?
Really from a sense of focus. We have a small team and want to make sure that we're really growing the side of the business where we do have a bit more of a TAM. We have a little bit more room to grow, and it also is impacting the people who are on the birth control pill, but then the people who are not on the birth control pill as well. And it actually came from us learning so much during our journey of bringing the smart case to fruition, of what people know, what people don't know, what questions people are asking. And it became very clear that of the people who initially, like, you couldn't use the app without the birth control pill case. And we saw so many people coming to us and saying, like, hey, I want to use this app, but I'm not on the birth control pill, because they saw that we were asking, their friends were telling them really that we were asking so many more robust questions than just about the birth control pill. It started with, how are you feeling today? And it's since grown into about 9 categories. And they wanted to really track those things. And we saw that people who were using more than just the birth control pill were even retaining longer. So even if they stopped taking the birth control pill and they stopped using the case, they were still using the app. So we knew that we were on to something there.
So what's the highest value prop you see now for the patients that are using your application?
There's really 2 big things. So from a patient, a solo patient, not even, we don't call them patients, they're our members. From our members' perspective, there's the element of, I don't actually know what is cyclical for me. So hormones and how they impact you, I know you know this, but they are kind of like our metabolism. The way that they impact you is going to be different from how they impact me. How they impact me at age 20 is going to be different from how they impact me at age 30. And so how does it impact me personally? And so what we do there is we show you your cyclical trends, and then we also forecast them. So across the 9 categories, we can say, like, okay, today, November 16th, you have a 41% chance of fatigue, and you have a 98% chance of cramps based off of your last cycles. And we can do that from an appetite perspective, sex drive, across each of our different categories. Mood is our most tracked category. And then also, of course, on the period side as well. So that's one. And then the second is really that we see that about over 45% of our members, there's kind of 2 pathways here. One is that either they actually think that, or thought before Aavia, that their symptoms were normal. We actually had a post that I'll never forget in our community where somebody was talking about these depressive symptoms they were having. Somebody told them, hey, check out PMDD. Aavia has this blog. I learned that it's actually not normal for me to have suicidal thoughts right before my period. I literally had chills. And then it got even more robust when people were commenting back, wait, this isn't normal? Oh, I heard that it is normal. And we're having to kind of myth bust here of, hey, suicidal thoughts is not something that's actually normal. And this is something that you can actually talk to your doctors about. So flagging that is one, but then second is, we're not human computers, right? So let's say we know that we shouldn't be feeling some way, or we don't like how something feels, whether it's physical or it's mental. we can actually help people understand how often things are happening, and then what part of their cycles are happening, so that in that 15-minute doctor's appointment you have, there's a really easy to digest graph you can show your doctors, instead of them having to spend that time to really ask a lot of those questions. And that's a big thing that the doctors have been telling us, of like why they need us and what they need from us as well.
So when you're talking about the app, is it free to use for your members? Is it a paid subscription? How is Aavia making money?
Yeah, we have both. So first and foremost, we don't sell your individual data. And that is something that's really important to us. And so then people are like, okay, so then how are you making money off of me? So we have a freemium model where we have a premium version of the app, and you can subscribe to that. And we actually see really great conversion rates because our members have seen the value that we provide. They know that we're credible, since we always cite our sources. Everything's always reviewed by medical advisors. And then we've also spent the last year really building trust. So expanding into the app side of things has really been in the last 12 to 14 months. And that's been our number one priority, is building that trust with our members. Majority of our members are Gen Z, so 27 is the oldest there, so 27 and younger. And at a larger scale, like, they don't trust big healthcare. And so we knew that that was the first thing we needed to establish, is that, hey, we want to build this with you. Our goal is to be here for you and not for to sell your data or for anything else. And so we want to build this with you so we can have the biggest impact. And we know that we have done a really great job of that in the last year. And now we're really expanding from there.
So talk to me a little bit about how you are actually finding people. I know you had mentioned word of mouth is a big one, but are you actually doing online advertisements? Are you partnering with health systems, partnering with any physicians? What is the way in which you're trying to grow the company now?
Yeah, great question. So we're kind of in a transition phase, or an expansion phase, if you will. So we did, while we were focused on more so building the credibility, building the trust, building all of our science-backed recommendations and things like that, we're doing mostly social media and word of mouth. And that's where we know kind of like what messaging works, what creative is working, and things like that. We have since actually been rolling back social media presence, just from a perspective of, okay, we've done our learnings here and we know that we can continue to run a specific playbook, but where do we want to start learning more? And that's where actually our members have been taking their data to their doctors. And so some doctors have actually come to us and said, like, hey, like, this is actually what I'd like to see. So we're now bridging that gap a bit more, from how can we actually support doctors, so that then they're recommending us to their patients. The biggest thing being that they're saying, like, hey, like, if my patients tracked 2 to 3 months of their cycle before coming in, and I can see that data, like, we can have a much more efficient conversation, and I can spend more of my time providing care versus like asking questions and then being like, I don't know, or, again, going back to that we're not human computers perspective. So that's our next take there.
So talk to me a little bit about funding. I know that you have been doing this for, is it almost 6 years at this point?
A little over 5 years, yeah.
Okay, so a little over 5 years. How have you been funding the company since the inception, and how many rounds have you raised, and what does that funding look like?
We got off the ground thanks to non-dilutive funding we got from MIT while we were exploring what we would do here. So really that first was, everything was focused on the smart case. We've then raised a pre-seed round of about $670,000, again, focused on the case with a bigger vision to go into the hormone health side. And then at the beginning of the pandemic, we raised about 2.5 million. That was our first truly institutional, co-led by Asset Management Ventures and Starting Line, participation from Meridian Street Ventures, January Ventures, and a number of really great operating angels that have been game changers for us, quite frankly. And then last year, we knew that we wanted to really make a big shift in terms of, okay, we know that there's a bigger opportunity here. People are asking so much for this. This is something that we know we can have a bigger impact on as well. And so we raised a round of funding, about 3.5 million, led by 776. And that's where we've been going off from there.
That's amazing. So several rounds of funding. How big is the team now?
We have about 6 people who are full-time onshore, and then we have 3 offshore developers as well.
Awesome. And where are you guys primarily looking to focus your efforts? Is it in New York City? Do you find that the majority of your patients come from major metropolitan areas? Where do you see a lot of your members coming from?
New York is where the majority of our members come from in pure numbers. I will say, though, we have people across every single country almost. In the US itself, we actually see it spread across the entire country. So even from smaller cities or smaller towns to the bigger cities, but then also internationally. We haven't actually frankly focused our efforts internationally, so it is really amazing to see that so many people are coming in to really learn about their cycles and sharing so much positive feedback. I know one of the things that it's been really amazing to see over the last few months, like initially when we first started on the app side of things, whether it was every week or every couple of weeks, we'd get one love letter from a member. And now it's a daily occurrence that we get multiple love letters, whether it's in our community or they're writing into support or it's on social media. And that's been really powerful.
So what are you doing in terms of growth? I know you are focused on the aspect of growing beyond the birth control case. Do you still actually have like a reminder in the app itself if someone is on birth control but doesn't have the case, like a way I'm imagining that you probably do.
Yeah, that was in there before we expanded. So we have all of that functionality exists. We still service those members. And so that is still there.
And in terms of the freemium model, so there's a lot of, different paths to even monetizing your members that are using the freemium. Have you guys thought about that? And if you have, in what ways are you thinking about actually doing that from a business perspective?
Yeah, we actually have a few things in the works, and I hope that in a few months that I can share a little bit more on that.
So Aagya, there's obviously other apps out there that are focused on women's health and tracking.
Mm-hmm.
Can you tell me a little bit about how you guys are different from your competitors?
Yeah, I mean, it's a lot of different ways, and I think it starts with just like what our intention even is. So a lot of the tracking apps are period tracking primarily. Yes, they might have other functionality within them, but ultimately that is the big thing that they're focused on, is like tracking your period, predicting your period. And then most of them have also expanded into fertility side of things. Our bigger thing is we're an entire cycle tracker. And this is for your entire cycle that's impacting many different aspects of your day to day. So we actually see that the top 10% of our members are logging every single one of the categories every single day of the month, which is very different from coming in to just log your period. And so we're really building the largest and most diverse data set when it comes to female ovarian hormone health, and opening the doors to understanding the connection between our hormonal, mental, and physical health as has never been done before. And that's really the biggest difference of how we are positioning ourselves, quite frankly, is like it's a full cycle tracking rather than just your period. Another part of it comes down into design, and we're not the pink flowery apps or talking about women. We're very gender neutral. We say people with ovaries is who we're for. The design, one of my co-founders, Aya Suzuki, is our product designer, and we get so many compliments on that, and people love that. And so even when just like searching through the app store, that really stands out to people as well. And we're started by people with ovaries. I think that that's a really big game changer for people. We haven't sold data. I know some of the other apps have done that, and there have been scares in terms of like, oh, is my data safe? We have an anonymous sign-in feature so that it doesn't even have to be associated with you in your email, and you can easily ask to have your data deleted as well. So there's a lot there, and I think that the bigger piece that you can't necessarily quantify is that we've just spent a lot of time building trust with our members, and they stand up for us. I know that we've been building the product with them based off of what they want and what they need. We've been providing transparency on either what's coming or data privacy from day one. we've been really supporting them to advocate for themselves, whether it's in the healthcare system, or with their parents sometimes as well, like, hey, like, let me show you what's going on. And then really focusing on this, serving science-backed and credible sources as well.
Hi, everyone. Before we get to the last part of the interview, be sure to hit the like and subscribe button below. It not only supports the channel, but it helps all of the entrepreneurs that we interview here. Thanks for watching. So I know Aavia is not a diagnostic app, but tell me about how this app can actually help clinicians. If you can give me some more specifics in terms of diagnosis of certain diseases as well as impact.
Yeah, absolutely. So this is actually what we're working with doctors on right now, is really bridging that gap of, what people might believe that their symptoms are, or how they're talking about their symptoms, or if they think that their symptoms are even normal, to then helping them with either plans or diagnosis. So PCOS and endometriosis is known to take about 7 to 10 years to diagnose. In fact, one of our existing investors, she actually has her own story about how she didn't even know she had PCOS until she tried to get pregnant, couldn't get pregnant, and then after a couple of years of trying and figuring out what's going on is how she got diagnosed. As we've been talking to our own members, it's been, upwards of 5 years is what they're reporting on when they started experiencing symptoms to getting diagnosed with PMDD, PCOS, endo as well. So our big thing has been talking to doctors about, like, okay, like, what do you need for us to put into your hand, or what would be helpful in order to help shorten that? As you said, we're not a diagnostic, but how can we support that? And the big thing that doctors have been saying to us is, if I can see a picture of, even 2 to 3 months worth of data, and you can show me those trends of, hey, this, for PMDD, for example, that these depressive symptoms are coming at this very specific time and not really at the rest of it, as well as like changes in a few other symptoms, then that really helps me take the next step. And so, okay, if not even 2 to 3 months, like, even if it takes a year at that point, that shortens the diagnostic time by so much compared to the 6, 7 to 10 years.
Yeah, I'm sure that's very exciting, not just for patients, but also for clinicians to have all that data in their hands, because I've mentioned this in other interviews that doctors our time is getting squeezed. And so the time we
Yes.
have with patients is becoming shorter and shorter in order for a lot of doctors to keep the lights on, and the expectations of seeing, 4, 5, 6 patients an hour, whatever, some crazy number it is. It's just not humanly possible to do that, and deliver the same quality of care. So a lot of these tools that exist, if patients can use them effectively and actually track things, it can be really, really helpful to a lot of people. So what is up for Aavia in 2024?
Really building this out much more robustly, making sure that we are ensuring that while we don't have patients, our members are being seen and being cared for in the best way possible, and really connecting with the doctors in a way that is meaningful and that we're actually helpful for them. So even with this, like, we're not asking them to change anything in their technology. Just share with us, like, when a patient brings you their phone, what do you actually want to see? Because I've also heard of, hey, there's all this data out there that people are getting that doctors may not actually either know how to interpret that, or they might not actually need in that scenario of what they're looking for. So really making sure that it is readable, if you will, in a 2-minute point, so that in the rest of the 8 to 13 minutes that they might have in an appointment, that they can provide the best care possible, instead of having to spend time really digging into the questions and getting the fragmented answers. So that is really on deck. And then I know I teased a little bit on where we're going with our business models, and some exciting things coming there. So we'll definitely keep you posted on that as well.
Yeah, I'd love to do a follow-up in about a year or so and see where you guys are at, and understand a little bit more about how you guys are monetizing and growing this so it can be more impactful for more people.
I would love to do that.
Awesome. Thanks for being here.